Well, good morning. My name is Dr. Grossman. I am a trauma surgeon, and I wanted to show you today a demonstration of a chest tube insertion or a tube thoracostomy. I have a simulated platform. It's a Trauma Man from Simulab Corporation, which is very, very interesting because it's very realistic. I have a Google Glass which I'm using to record this procedure from the perspective of the surgeon, and also I have a ThetaS camera, which is a 360 degree recording camera, which you can then manipulate on the smart device, or you can put your phone on a Google Cardboard or any other 360 degree viewer, like a VR1 or a Viewmaster, etc., and then immerse yourself in the actual procedure, being able to view in a 360 degree spherical presence the actual procedure and transport yourself to the procedure area itself. So in any case, it's very important, as with any surgical procedure, that you follow your universal precautions. I'm going to obviate them for the purpose of the screening, but you put your mask on, okay, your mask on, and a hat as well, and obviously a gown, a surgical gown to protect yourself. And most importantly, the surgical gloves. So surgical gloves on. The indications of the procedure I'm going to obviate, but this is a chest tube, and as you can see, a chest tube has numbers in it, and the numbers, okay, the numbers are by a way to measure where the tube is. The numbers don't start at the tip, the numbers start at the last hole. At the last hole. It has holes on the side, and that last hole needs to be inside the pleural cavity. Otherwise, you will end up getting a persistent air leak. The numbers start in the last hole up to, you know, the beginning of the tube. In any case, we set up the tube by connecting a clamp, a Kelly type curved clamp on the tube to help us, you know, direct the tube when we are going into the patient's pleural cavity, and we inject a local anesthetic after having prepped the area with a solution. Okay, I'm going to obviate that to sterilize the area. This is a sterile procedure. It's very important that you keep proper precautions to make the procedure a clean procedure, because infection of the pleural cavity is a very, very significant morbidity, a significant complication. You can develop basically empyema, which is pus in the pleural cavity, which has a high morbidity and possibly even mortality. In any case, after that, again, you know, you inject an area which should be in the 4th to 5th intercostal space. You want to inject the area of the intercostal space and focus on the top of the lower rib in order to prevent injury of the neurovascular bundle. So once you choose your site of insertion, you can make an incision, okay, and once you make an incision, you use a curved Kelly clamp, again, to dissect the area, the subcutaneous area and the muscle, and find the top of that rib and push into the pleural cavity. And once you're in, you want to put your finger and do a digital exploration so that you can see that there are no adhesions between the actual lung that it's inflating and the parietal pleura. And once you confirm that, you actually feel the lung inflating against the tip of your finger. Then you can then get ready to place the tube in the pleural cavity, again using the curvature of the Kelly clamp to direct where the tube is going to go gently and in a way steadily to make sure that this one step does not injure any parenchyma. And then at the end, you have the tube in place. You select, the adequate length of the tube inside the chest cavity by looking at the numbers, knowing again that the numbers start at the last hole. You want to have that one hole inside the pleural cavity, and then you basically secure the tube. There are many ways to doing this, but one easy way is to use a suture material on a Keith needle, and the Keith needle is a straight needle, and there are many ways to do this, but I personally like to do a type of a suture that secures the tube in a way that allows you to have some degree of flexibility. It's like at the end a Roman sandal type a technique. Okay, so once you do that, you have a very good way to secure the tube so that you can prevent this from dislodging. Okay, and then you obviously put some Vaseline gauze around the area to prevent some air leakage, and then a dressing that has to be sterile. And this is it for now. So I hope this was interesting and educational for you. Thank you very much.